we know. Hard times seem to be unending. Are you having difficulty agreeing with Spafford's resolution in his first chorus? Whatever my lot, thou hast taught me to say, it is well with my soul. See, Spafford didn't deny the reality of his suffering. He reportedly wrote this song, It Is Well, after the ship he was on sailed over the very site where his greatest tragedy occurred, where he lost his precious daughters. But neither did he deny the reality of his Savior's love. Spafford knew what we can know today, that our hope is in Jesus. Not in our present circumstances, but in his certainty of the Lord's strength to see him through. Not in where we are, crippled by fear and unsure of the future with this crazy virus, but in who God is and how much he loves us. In the days ahead, I pray that you look up to God and then out to the world around you and ask how God can use you where you are for his greater purposes, and believe that he desires to accomplish his will through you. Our hope in hard times rests in the Lord, and it is only through his love, his plans, and his will that we can all agree with Spafford that it is well with my soul. May God bless you today.
Thank you so very much, Captain Madsen, and thank you for all that the Salvation Army is doing to provide essential food and services to so many in our city. God bless you. It is a point of personal privilege that I have today to welcome our featured speaker, Ashley McCumber, both the CEO and Executive Director of Meals on Wheels here in San Francisco. Way before the COVID-19 virus, Meals on Wheels has been an integral and critical organization and agency that has provided food security for the most vulnerable residents in San Francisco. Ashley, we welcome you. Please tell us about your agency, how it's been impacted by the COVID, your staff, your clients, the neighborhoods you serve, the programs that you've had to pivot to, and also services and volunteer opportunities that might be available. The floor is yours.
Well, first, let me say happy birthday, Michael. Secondly, let me say how much I respect the work of the Interfaith Council. And I have watched during this crisis how you've stood up to really bring community together to help the faith community really find its place in this crisis. And I have a lot of respect for that. Thank you for doing that. I also want to give a shout out to my dear friend and colleague, Kaushik, and hope to see you soon in person. Really could, is a treasure in my life, and I really respect you a lot. What I'd like to do today, if I could, is to share with you a little bit about what Meals on Wheels was the day before COVID-19, what we have become during COVID-19, and then maybe exit by just sharing a few learnings and projections that I feel that we need to start talking about during this crisis. And I'm going to lead us through this morning with a slide deck that hopefully I will pull up right now, the right one. Here we go. First of all, Meals on Wheels likes to use the term nourishing the whole person. The fact that we're way more than meals. We're looking at the whole person. Let's see if I can get this going. Okay. There we go. Ironically, this is our 50th anniversary of operating in San Francisco. We certainly did not anticipate, as many of you did not anticipate, spending our 50th anniversary in the middle of one of the largest crises we've seen in our lifetime. We're a local grassroots movement. We're locally operated and funded. And I bring that up because obviously the brand Meals on Wheels is powerful. It's in every community, but we're not chapters. We're local 501c3 organizations that take different forms, but we're bonded together in mission and work nationally as an association, and we're very proud of that national work, but we all work independently. We have operated our own industrial kitchen in the Bayview for over 30 years, and our primary mission is to provide home delivery meals to thousands of older adults, and we consider that 60 plus, and now we serve also adults with disabilities. Our mission is pretty simple. Meals on Wheels San Francisco and its volunteers provide seniors with what they need to live independent and dignified lives, nutritious meals, professional social work, and friendly human contact. Who we serve. Well, first of all, we are now serving, if you can imagine, and my dear friends over at the Salvation Army will appreciate this, over 2.2 million meals a year just in San Francisco to our populations. And we know that that's going to increase, COVID or not. By 2037, there'll be 100,000 more seniors living in San Francisco than there are today. By the numbers, this is what we looked like at the end of 2019. Again, I mentioned the number of meals that we're serving, and that doesn't necessarily count the meal equivalents in home delivered groceries. This is something I like to say over and over and over again about our population, that 73% of the people we touch on a daily basis live on less than $1,000 a month of income. Let's let that settle in for a moment. How can someone live in San Francisco on $1,000 a month of income? And so you can get a pretty big picture that not only are we a nice program, we're a true safety net program. In a given year, we touch between 4,300 and 5,000 unduplicated clients, and we know that 70% of those clients live alone. When you look at the demographics of our clients, you can see the kind of the age dispersion there. I joined Meals on Wheels in 2007, and overwhelmingly, first of all, we were a quarter of the size we were now. We were serving about 1,200 clients in a year, and I just mentioned that we're up to 5,000 clients now. But those clients 12 years ago were overwhelmingly over the age of 75. And if you look at this age demographic shift, you're seeing that we have a lot more what we call younger seniors. And we are also now seeing disabled people in their 50s in our census as well. And what that necessarily means is a lot of different things, from it's tougher for people to age in this city. And that if you're under financial constraints, it's even harder. And people are living through illness, but not necessarily living with more independence. Those are kind of the key things to learn of why this shift. And I think lastly, we've probably done somewhat of a good job of moving people off the streets into supportive housing, but they are not necessarily in the best health. And so I think that's reflected in our census. If you look at the ethnicity of a Meals on Wheels client, it pretty much reflects the city's population to the most part. I mean, obviously, we know that minority communities are underserved, and they show up in our nonprofit censuses at a higher rate. The one unique thing about Meals on Wheels is its disproportionate service to African American seniors. So you can see that 26% of our clients are African American, and even at the most generous, you would say that the African American population is at 6%, but most people believe it's much lower than that. So that's kind of who we serve. We also really serve only those people with limited ability to shop, limited ability to cook, and little to no support. So if you can go to a great senior center or a food pantry and you're able-bodied, then we want you to do that. We really want to focus on those people, but for us, probably would not be getting adequate or appropriate food. When you look at what matters to clients are really these three things. The majority, 83% say it improves their health. 92% says it's a big reason why they're able to remain at home. And 87% say they feel safe and secure. So I talked about, when I opened up, the more than a meal statement. And so just to quantify or qualify, we're primarily a home delivered meal program. We're preparing meals and we're delivering them to people. We actually provide to all of our clients 2/3 of their daily nutritional requirement. So that's 14 meals a week or 2 meals a day. And that's going again to people 60 plus and those who present like our senior homebound clients, but they're under 60, adults with disabilities. We have a very robust home delivered grocery program in partnership with the food bank, and we deliver to 450 people a week in that bucket of service. But beyond the food and the home delivered groceries, we're really about putting eyes on people and making sure they're safe. And if they're not safe, we make sure that we do something about that to find them, to figure out why they're not answering the door, what we can do to stabilize their situation and respond to that. Beyond that, we have 3 registered dietitians that provide nutrition counseling and education. We have an entire social work team that can do everything from information referral to home assessment, reassessment, and in some cases, case management. We have a volunteer program that matches volunteers with friendly visiting and also friendly shopping is what we call it. We do minor home repairs to make sure that people are safe in their home, grab bars, etc., and focus in on home safety and urgent needs. One of the biggest things that we do is we provide any client that doesn't have their own kitchen, a refrigerator, and a microwave. Over 100 and probably 25 a year. I don't think a lot of people understand how many people live in SROs, single room occupancies, without kitchen, and we certainly can't give them food that they can't store or heat. And so that's a big part of what we do as well. All right, so that was the day before COVID-19. What about the day after? Our core mission during the COVID-19 emergency was first to ensure that our staff are safe and healthy, and that the meal productions and deliveries remain uninterrupted so that homebound seniors do not miss a meal and they in turn are safe. Our core focus was we cannot become a burden to what was going to be, and as we know, a big burden of food security in the city. So if we could remain first whole as an agency, then that would be a service in and of itself. So it was focused on continuity of services and meals, focus on our population, so serving seniors, adults with disabilities, and the other thing that we are currently doing is providing the meals to the city's homeless navigation centers. And obviously, we know there's some shifting going on with how we're going to manage navigation centers in this crisis. We're also interested in expanding services to those 3 populations as we can, and then focusing on serving more new housebound populations if the need arises and we can match the need that the city wants us to do, and so forth. So that's really kind of our focus at Meals on Wheels in the crisis. How we had to change to be able to do that. Well, first of all, we've had to increase our staffing assets and numbers to maintain safety and also to cover for staff who are at home. We have an older workforce. We had to send home about 12 people who were 65 plus. And so those people needed to be replaced. We also have what we're encouraging as we all are to have people stay at home if they're sick, and we need to make sure that we're still operating. So we operate on any given day with about 60% of what we typically have in-house, with about 40% either at home doing their job from home or at home not doing their job because they're sick, or it really isn't safe for them to be at work and so forth. So that was the number one thing that's changed. We implemented immediately, even before the stay-at-home order, no contact meal deliveries, because we realize our clients are most acceptable if they were to catch COVID. So it's really a knock on the door, a step back, drop the delivery, hopefully see the person or talk to the person from 8 or 10 feet away. We've converted all of our social work visits to phone visits and amplified those to make sure that people are doing okay. We restructured all of our operations to change our delivery routes and menu structures. It's like an amazing amount of change. We moved from what was a 6-day delivery pattern to a 2-day delivery pattern. So we're dropping food twice a week rather than 6 times to minimize the risk as well as to serve more people. What have we accomplished in doing all of this? First of all, we've started 584 new clients between March 16th and May 6th. That's 20% higher than a typical week, and that number continues. So we moved from making about 8,000 meals a day in our kitchen, which is already way past its capacity, and I'll tell you about that in a minute, to producing 10,000 meals a day in the kitchen. We've increased client assessment by 200% and implemented kind of a virtual safety check program, taking those social workers that would have been in the field and some staff that have moved into basically safety check calls to our client. And I recognized in the first week before we got too far into this COVID crisis that I had to have a backup plan if we had a COVID outbreak in our kitchen or in our organization. What would happen if Meals on Wheels suddenly had to shut down for a period of time to figure out how to deal with an outbreak? And so we immediately went into a mode of building, much like the Salvation Army talked about earlier, of building their program that's happening this Saturday, 3,000 shelf-stable boxes that we now have stored, which is basically a 14 meal box. So at any point in time, we could drop those boxes to our clients and know that at least for 7 days, they would be stable and they would have the same shelf-stable amount of food and so forth. And I can't tell you what a massive project that was, particularly because our menus are very prescribed. So we had to source exact quantities and exact food, and it was not very easy in the supply chain to get that done quickly. What are some of the observations and lessons learned from COVID-19? First thing, and I think most of us in the safety net business would really feel this way. Why does it take a pandemic to remind us about how bad existing situations are for vulnerable populations? Why are people surprised about the things that we're seeing? That too many people are living on the margins without a safety net, that 40% of American households do not have adequate funds to make it through any crisis. And this is particularly true of certain populations. We know that minority, Black and brown communities are always disproportionately affected by almost every health indicator, every crisis, every job layoff, et cetera. This is another thing that I think that we're uniquely in tune to, is the idea that housing or lack thereof affects your health and food security. It's really hard to get someone adequate food if they don't have a kitchen and a place to store food. So we have long talked about the need to look at the single room occupancies, SROs, with a different light of how we look at it as a food security issue. And I think that this crisis has particularly brought that into the light. And then the last thing is, this is true for all of us now. So I think we're beginning to understand what was true for homebound seniors before, that isolation is a public health issue. One of the stats that has been brought up to prove how much of a public health issue it is that loneliness is as harmful to health as smoking 15 cigarettes a day. And I think that now that we're in this duration, I think we kind of understand what was there the day before COVID-19 for people living alone, homebound. The other thing that I think is really true is that many of our seniors at home now are really housebound. So at some point in time, things will open up again. They're able-bodied and so forth. But many of them, their health may deteriorate, and many of them may not be able to go out, and they're going to need continued services after the stay-at-home order is lifted or shelter in place. So as things are rolling out, we're going like, how are these going to continue after all of the attention, the money goes away? I think nonprofits in the faith community, we're built to be resilient. This is who we are, but this crisis is quite different. And I would say a couple of things. One, we have an amazing food security infrastructure in this city. And we have worked together for decades to be prepared for an earthquake and to do congregate feeding, to respond to bringing people to parks or organizations or streets to feed them. This crisis has turned that on its head. It said that, no, we don't want people to come out. We want people to stay home. So a lot of our community partners that are used to feeding people in congregate setting are having to stand up and do it differently. Have a drop off or pick up or go completely to what we do every day, which is home deliver meals. So it is quite different. I think the second thing I would say as a frontline provider that's quite different is the duration. I mean, I think we're now beginning to say, when is normal normal? Or when is there a new normal? I think I would say that in the last 2 weeks, it's felt a little less hectic and a little less chaotic, but we know that that can change on any given day at any given time. And I think the last thing I say as we start rolling out these new models is that once people return to work, we need to understand that the need does not go away. And even if the donations and the heightened donations right now and the funding from government goes away, the need is still going to be there. And I think we need to start talking about that. Michael mentioned earlier about volunteer opportunities, and I will say this as kind of a header. I mean, obviously, we're kind of limiting contact with clients right now because of the crisis. So a lot of the typical things that we would have non-COVID period are not really activated right now. But there's a couple things I would draw out. One, the home delivered grocery program on Wednesday is completely volunteer packed and delivered. And we always can use people to sign up for that, although we do have a robust group of people. So that's one way that people can help. We are kind of interjecting in a very measured way volunteers in home delivered meals when needed. We're limiting that because obviously of the safety issue of bringing people into our universe and our office, as well as going out to the public, not as trained as, let's say, our professional drivers would be. There are obviously no special events, but once they kick up again, I should note that 20% of our budget comes from one event that was canceled in May. It's $3 million I had to replace. I'm going to stop there and breathe a little bit because that was a big deal. And luckily people have stepped up to help, and we're almost whole on that, but we're very uncertain about where those will go next year. We're doing a lot of, special occasion and card programs where people are working in that way. And the other thing that we are cranking up is our friendly visitor program by phone. And so that's something we're kind of stepping back up again and trying to engage more people to do. And if that wasn't enough, in our 50th anniversary, lo and behold, we're in the last 100-day countdown of a capital campaign and a building. So the stress and the excitement around Meals on Wheels was already pretty high. We have this facility you see on your screen is a facility being built on Gerald Avenue near the produce market in the Bayview. It is going to move us from about 9,000 square feet of real kitchen and production space to about 35,000 square feet. It's a building, brand new building built from the ground up. It's a $41 million project. We have secured, or at least until COVID had started, we were up to about 36 million of goal. And honestly, the campaign has come to a screeching halt. So that's a challenge that we'll have to kind of re-engage in. But this facility is even more important now. And the reason why I say that is because we've had to, for safety reasons, we've had to rent another kitchen to spread our staff out. And so luckily we found the kitchen about a block away from our current kitchen. And once this kitchen opens, hopefully in October, we'll be able to integrate those staffs back into this building safely, with distancing and with a state-of-the-art facility. This particular kitchen will triple our daily capacity. And we'll look forward to applying that capacity if needed in the future to respond to the growth of seniors. But frankly, if this crisis peaks up again, we'll need to step in and do that as well. So that's the Meals on Wheels story right now, and I'm happy to turn it back over.
Ashley, thank you so very much. This presentation exceeded any expectations, and both in the services you're offering as well as the challenges you're facing, you're among people of faith, and if our prayers count for anything, you have them, and you have our friendship, and you have our support, and I'm hoping that by way of your presentation that some folk will step up and help and support you and the organization in any way they're able possible. What we've been doing in these gatherings is we invite 3 faith panelists to share in brief, about 5 minutes each, about how the COVID-19 has been impacting their particular work, and then to ask a question of you. So sit tight and be prepared, okay? The first of our faith panelists is the pastor of Old First Presbyterian Church and also a past chair of the San Francisco Interfaith Council, and someone I consider a friend, the Reverend Maggie Henderson. And Maggie and I, when we talk as of late, one of the things we've been talking a lot about is the food pantry that has been operating at Old First for some time. It is part of a larger network of food pantries from the San Francisco Marin Food Bank throughout the city. And Maggie, we welcome you, and this is will be a unique opportunity for you to share, perhaps on behalf of the many food pantries throughout the city that are being hosted at congregations, what you're experiencing now, before and after, and what some of your needs are.
Thank you, Michael. I'm the pastor of Old First Presbyterian Church on Van Ness in Sacramento, and historically about 9 years ago, the food bank came to us and said, we're going to give you a grant for a year if you have a food pantry in your area. And Old First, we love a deal, so we said yes. So my little church did it for a year, and then we were so exhausted, we stopped it. And a friend said to me, came back and said, you got to keep doing this. And I said, my people are tired. And he said, let's ask partners. So we did an interfaith food pantry. We've got St. Mark's, Lutheran, that's my cat, welcome to my world. We've got see, the cat flusters me. We've got St. Mark's Lutheran, we've got St. Luke's Episcopalian, we've got the Unitarian Universals, we've got Calvary Presbyterian, and we do this every week together. We're the only interfaith pantry, and it's calm, and we hired our coordinator, and then this craziness started. And all our coordinators are in the age they're too old to do this. And a lot of our volunteers are too old. But one person said, we have to feed people. So we figured out how to feed. Now we're up to 280 bags of food a week. And it's crazy making, because we have to do it outside. We've rethought it. It's 25 volunteers working from 7:30 in the morning to 11:30. And it's hard work, and they still say yes. And they're coming back every week. And we have to figure out how to do this every week. I mean, there's like no normal. But what I'm observing, my job is to be outside and kind of welcome people and be a bit grumpy when I need to be, because it's a gift, and say, no, you can't do this, or welcome, and one of the things I do is the change is so hard on people. I mean, all they're getting is change, and we're changing the food pantry, and then we're making change each week. So I'm aware of this whole thing is really hard on people. And one of the things I'm doing is I'm talking to people on the street that are passing me. I'm saying, you know, we're taking up a whole block outside, because this is how we do it. I said, do you know about the food pantry? We're feeding these many people. And people are like, really? And the guy one week gave me $200 cash to give it to the food bank. And what I'm also finding is I'm telling people, if you need some food, if you come at the end, we may have some leftovers, and we're really trying to do that, and you can get food. And these are people that say, oh, I've never asked for that before, but I lost my job, I don't need it. And they'll come back the next week and say, can I still come after? So our line at the end of people that don't have cards and don't kind of have spaces in the food pantry already, they're the ones that are now getting food. And that's stunning. I mean, these are people who thought they'd never be in a food bank line. They'd never need food. And that's what kind of amazes me, and they're coming back every week. So what I'm learning is people are hungry in a lot of ways, and they're having to make decisions about where to spend their money, and where food was always there, they don't have that money anymore, so they're coming for food. So I find that just amazing. I'm amazed that so many people are willing to help. We have 25 volunteers a week, and this is hard physical labor. And we're also putting ourselves, you know, in some ways at risk, because we're around people. We're trying to be safe, but, you know, the virus doesn't really care. So I'm amazed with those things about what we're doing, that people are trying so hard, that the food bank's nimble, that people are still getting served, but so many people are hungry. I mean, that's knocking my socks off. They are not my usual people, and they're coming back every week to get more. I think last week we actually fed 280 people with 2 bags of food each. That's a lot. And my question for Ashley, Ashley, if I have, can I ask my question now, Michael?
Absolutely.
If my people want to get, need these meals, a lot of times they're hesitant and I have to walk them through that. Who do I call? Is there capacity for them? Can I understand it so I can help my members who have needs of these meals that one either don't want to admit it or a little bit ashamed or it's for other people and not me? So how would I do it and how could you help me walk my people through it? Okay, goodbye, Kat. Lord have mercy.
You know, Maggie, that's a really good question because even pre-COVID, you know, a lot of people really think that they're less needy than someone else.
Yeah.
And so they don't want to take something from someone else. And so we need to all constantly, even before COVID-19, remind people that, no, this is there for you. There is no, quote, income screen for our program, even though we know a lot of our folks are lower income, really low income. The process for getting on home delivered meals and getting food services, if you're a senior or an adult with disability, and in this crisis, that is very generously described because so many people are now housebound, not necessarily long-term homebound, but housebound. They would still need to call the Department of Aging intake line, and I am so crazy that I forgot to put the number right in front of me this morning. But it is the single line. Coach, do you know it? Off the top of your head?
It's 415 area code 355 6700.
Thank you for saving me. So the that line, why that's important to call that line is because they will then be able to assess the best match for that person. So it may be that they need to connect to a food pantry. It may be that they need to connect to another service that fits them better. Like they want to still cook their own food, they just need food. And so that's the line that people would need to connect. The other thing that's really good is that the city provides an array of services to help people stay in their homes and to stay active. And we need to let more and more people know that that's for everybody.
Not just people who won't, it's not income.
No, none of the,
Okay,
you know, this is a really good point. Most of the programs for older Americans were not set up to be poverty programs because there was a realization that as we age, we might need some assistance regardless of income to be able to maintain our what we call aging in place. And so most of these programs, with few exceptions, do not even really take in financial information. You know, obviously the ones that are linked to things like housing have to, but most of the Department of Aging programs, we want everyone to connect to them if it benefits them from staying in their neighborhood and in their community. And I just want to kind of do a shout out back. I meant to say earlier that, you know, the faith community is really on the front lines of making sure that seniors as they age in their home are still connected to a sense of community.
Amen.
Yeah, and so we're partners in this in many ways. So I just think we need to get the message out that yes, it's unique right now, but people should not be ashamed to call and find out what is there for them every day and specifically right now.
Ashley, thank you so much. And thank you for raising that last point because the San Francisco Interfaith Council has worked collaboratively with both the Department of Aging and Adult Services, which is now Disability and Aging Services. And we are very grateful for the support that we've received from the Meta Fund in order to do that and to sustain that. It's an important collaboration, and I know it's one that allows us to partner with you.
Yeah, and if I could just add one more sentence to that. You know, we like to think about this as the right thing to do, like it's morally right to help someone stay in their home and maintain their independence. It's also a ridiculously smart thing to do.
Absolutely.
Because if they're in their home, in their community, they're healthier and they're not in hospital beds and they're not in assisted living and they're not in skilled nursing. And so it's really a smart thing for us to do as well.
So 415-355-6700?
Yes.
Okay.
That's it. In introducing our next faith panelists, I want to take just a moment and a liberty to say a special thank you to Senator Scott Wiener, who reached out to me recently just to see how the council was doing. And I asked him what the big issues he was tackling were, and among them was food security. And in that conversation, I told him about today, and he was the one to recommend Ashley to present today. And so I want to say a special thank you. In the same conversation, though, when I mentioned that I had invited Human Rights Commissioner Hala Hijazi onto the call, he said, you know, we are doing such important work together in some vulnerable neighborhoods. So he was very pleased at that. Hala is not only a commissioner with the Human Rights Commissioner and a member of the Interfaith Council Board, but she is probably one of the most best network Muslim Americans in San Francisco. And I would invite Hala, my dear friend, to offer her presentation.
Thank you, and happy birthday again, Michael. Thank you for your leadership and your support, as well to Kashik and Ashley. You did an amazing job. I'm not sure I feel like I can even do a presentation after that inclusive presentation. Thank you, Ashley, and all the work that Meals on Wheels is doing for the communities. I just want to start off with just some of the prepared remarks I've had, and then kind of bring the story into place. So in the name of God, the most gracious, the most merciful, peace and blessings upon all of you and your loved ones. Our prayers and hearts go out to the individuals and communities most impacted by COVID-19 and their caretakers. And our hearts are broken for the over 100,000, probably not even including the uncounted deaths that have fallen because of COVID-19. We are tremendously grateful for the city's leadership and for the courage and commitment and sacrifices of our essential service public servants and professionals. Prophet Muhammad, peace be upon him, said, "The believers in their mutual kindness and compassion and sympathy are just like one body. When one of the limbs suffers, the whole body responds to it with wakefulness and fever." Since the beginning of time, houses of worship and faith-based organizations have been serving on the front lines and as a one-stop triage safe haven. Today, faith-based communities are responding with wakefulness and fever. They have stepped up in unprecedented ways. They are mobilizing resources and services to house, clothe, feed, and provide PPEs. We are fighting for our brothers and sisters' dignity, livelihoods, and lives. A man asked the Prophet, peace be upon him, what Islamic traits are the best? And the Prophet, peace be upon him, replied, feed the people and greet those. I'm going to repeat it. Feed the people and greet those whom you know and those whom you do not know. Across the country, all faith-based organizations, including mosques and Muslim organizations, are preparing, serving, and distributing food to all Americans in need. It's not only low-income families with children who are in need, it's also individuals and families who lost their jobs and dual incomes and are experiencing splitting up their households because of domestic violence or mental health issues. Most of these organizations are partnering with food banks and pantries, serving meals to healthcare workers, delivering food boxes to those who lost their jobs, distributing prepaid Visa cards, and providing monthly food assistance to low-income families with children. In the Muslim community, some of the top organizations that are leading this effort that are also partnering up with the likes of the food banks at the pantries is Islamic Relief USA, that has raised over $2 million to provide food to all the different organizations, Islamic Circle of Northern America, Islamic Society of Northern America, and locally, and for the past 12 years, Yassine Foundation, in partnership with the Family Harvest Program, provides 450 families with monthly produce and protein. And Support Foundation has led 47 organizations in a regional interfaith effort to distribute over 50,000 pounds. That's 50,000 pounds of food and PPEs, and also mobilizing over 300 volunteers. Over the past 8 weeks, over 36.5 million Americans filed for unemployment insurance. California's unemployment rate is likely now above 20%. And locally in San Francisco, to bring it home, 1 in 9 residents have filed for unemployment. In the next couple of weeks, that too will rise. In addition to supporting faith and cultural-based organizations, we must also support critical organizations, including the SF Marin Food Bank, Salvation Army, Shanti Project, Hands On Bay Area, American Red Cross. There's just so many organizations, but these are the ones that I've been working with and the Muslim community members have been working with. One of the examples that I have to share, it came to my attention from John McKnight. And this just to show you, when we talk about how, all hands on deck, there was a fire in Melbray. And we had to mobilize, and the American Red Cross did not know who to contact in Melbray because more than dozens of people were displaced by the fire. I think it was around 33, and half of them were actually Muslim families, but they were also wanting to adhere to Islamic law on how to feed them halal meat, halal foods, and kosher foods. So between John and I, we mobilized resources from across the country to deal with the Melbray fire. So this is what we're dealing with right now. It's no longer a San Francisco-based issue. We're all working together to make sure. So now they're all been housed. Their housing has been found for them. They now have, we're raising the foundation, the Support Life Foundation is raising close to $50,000 to provide each family with about $5,000 each. We're providing them with housing. And the most important thing is the youth, is the children. How do we keep them safe? The most important thing is, yes, housing, but it's also food, but it's also mental and emotional care. So this is some of the things that we're working on. This is one of the things that we need help with. But I am just so grateful for the likes of John McKnight, the Emergency Operations Center that has been acting like a triage center, not just for San Francisco, but for the Bay Area, and has been a trailblazer and setting standards to move forward. I just want to thank everybody of all the work that you guys have been doing. One of my questions to Ashley is, when you have organizations or Jewish community members or Muslim community members or Hindu, and they have specific feeding requirements that have to adhere to their religious and cultural, how are we dealing with that? What can we do? So for instance, in New York, Governor Andrew Cuomo has given more than 500,000 halal foods almost a day to people. That's just average 500,000 meals. What can we do, and what can we do with other organizations to get them to do the same in San Francisco?
Great question. Ashley, you're muted.
There we go. It is a great question, and I think it needs a lot more work. To be honest with you, it's a missed need, and it needs probably a lot of us in the food security bucket to have a conversation about who can actually rise up to meet that need, because it's very specific. I think right now, as it relates to kosher meals, it's the Jewish Family and Children's Services that is really kind of contracted to provide that. I frankly have not heard of anything outside of that. And so I do think that there's a real need to have that conversation and to figure out how and who can do that, and frankly what the kind of the scale of the need is as well. Right. And so I'd be happy to have that conversation with you.
So I would love to have that conversation with you in this SF Marin Food Bank, because I also got contacted by the Tenderloin neighborhood the neighborhood stakeholders in the Tenderloin. There's a huge, as you know, Yemeni population, immigrant population, also Iraqi population. When they go to their food banks, sometimes the pantry, there's pork. So they won't have protein for that week. So there is a need. So I have been in my position as a Human Rights Commission, and also working with our stakeholders, working with the Chinatown Development Center and the Tenderloin neighborhood folks to see how we can make sure that they have the food that they need. So right now I'm working with some restaurants to see if just individually we can pay for them. But I think there needs to be more of a structure on finding one or two restaurants in San Francisco. That way we're helping the small business owners in San Francisco stay open, but also meeting the needs of a lot of those immigrant communities and also religious communities that are adhering to their laws.
Yeah, I definitely think that there are solutions to be found. The question is there the will and the funding to make the solutions happen? And I do think that, and everything, unfortunately, in terms of sustainability comes around to who's going to support it long term and how is that going to happen. And some of these things don't cost more, they might cost less, or some of the things may cost more, but someone has to be on deck and someone has to take charge of it. I would say, as it relates to seniors and adults with disability, the place to have the conversation is with the Department of Disability and Aging. Because they really can then look at the food ecosystem that we have in San Francisco, and maybe with knowledge about the Bay Area, and say what would be the best solutions to these issues.
Thank you. And Hala, I think you have great allies in the city that want to work with you on this. And I'm glad the two of you are connected now. And I'm glad, as a former commissioner, to connect you with the Department of Disabilities and Aging Services. Great, very, very important point that you brought up, and we need to follow up on it. Thank you.
Could I just add, Michael, one more thing? You know, the aging network, and we're talking people who are aging, who are homebound, who really need solutions, is really managed through what are called AAAs, Area Agencies on Aging, and ours happens to be the county, but some are multiple counties and multiple systems, but they really all emanate all the way up to the California Department of Aging and the Aging Commission. And I think this is a conversation that needs to start at the state level and then trickle down to the AAAs.
One of the silver linings of this whole pandemic has been meeting Kim McCoy-Wade, who is the director of the Department of Aging for California. She appeared on one of these briefings earlier, and I'm glad to make those connections. Thank you. Our final faith panelist is Nama Haviv from Mazon, a Jewish response to hunger. And introducing her, I want to say a very special thank you to my friend Hallie Barron from the Jewish Community Relations Council. I had attended an event for JCRC years ago, and I learned about Mazon, and I have been captivated with their work ever since. And Nama is joining us from Los Angeles, and it is a blessing to have her with us. Nama, the floor is yours.
Thank you so much, Michael, and thank you, Ashley, and thank you for everyone for having me. Mazon is a Jewish response to hunger. We are based here in Los Angeles and also have an office in Washington, D.C., where we work hard on ensuring that people of all faiths and backgrounds across the United States have access to the food that they need. Our work is mostly through advocacy and public policy change, or entirely through advocacy and public policy change, as well as education work. And the reason we focus in that regard is because of the scale of the issue of hunger in the United States. You know, before the pandemic hit, we had 40 million Americans who were struggling with food insecurity in this country. And the COVID-19 pandemic has really thrown the gaping holes in our safety net into stark relief. I just want to think about the scale of 40 million Americans. The entire population of Canada is 38 million people. And now we have as of this morning, about 36 million people newly unemployed, and people who were living on the margins, people living in poverty and the near poor, really being plummeted into disaster. And I think because of this, we've seen charities that have done such incredibly important work, but were stretched thin even before the pandemic, really hitting absolute capacity in a way that is just devastating to watch. We've all seen the photos of lines, miles-long lines at food pantries and food banks across the United States. And I'm so moved by how much you all are doing on the front lines to get the food that people need to them as fast and as immediately as possible. And that really is where Mazon is working as well. But we are looking to the government to fill in the massive hole that charity alone right now is unfortunately struggling to fill on its own, which is unfair to all of your organizations, and just impossible for you all to achieve on your own. Unfortunately, in California, seniors are incredibly vulnerable to food insecurity. We have a lot of food insecurity in California, and seniors are deeply, deeply food insecure and have so much need. And organizations like Meals on Wheels, Ashley, it's just so inspiring to see all that you're doing to meet that need. But only 19% of eligible seniors in California access CalFresh, which is our state's SNAP or food stamps program. So 89% of seniors who are income-based eligible for the program do not apply. And so many of them do not apply because of shame, because of stigma, and because of access to being able to apply to those programs. We're incredibly grateful to State Senator Scott Wiener as well, because his bill, Senate Bill 882 in the California State Senate right now, would make it easier for low-income Californians in general, and especially older adults and people with disabilities, to sign up for and stay connected to CalFresh. I think that's incredibly important. And one of the wins that we've had just in the last few weeks, based on a lot of our advocacy and advocacy from our partners at the federal level, which we do a lot of, is to make sure that California was able to apply for and win access to online purchasing for SNAP, which I think is deeply important for homebound populations and at-risk populations like seniors. I know that we're short on time, so I'm going to try to limit my remarks a little bit. It's just that the one thing that I want to say is, and then I have a question for you, Ashley, is, you know, for us as a Jewish organization, our goal in getting people the food that they need to live and thrive goes beyond nutrients and calories, because I think for so many of us from faith traditions, we know that food is so much more than that. Food is a language that we use to tell the story of who we are to our families and who we are to our friends and our communities and to ourselves. And when we're cut off from that, we're cut off from a piece of our humanity. And Hala, I so appreciated you bringing up the question of kosher meals and halal meals and how people can access the food that they need for their own dietary and religious and faith considerations. It's one of the reasons that Mazon pushes so hard for an expansion of SNAP and an increase in SNAP benefits, because SNAP will put money in people's pockets to purchase the food that they need on their own terms, for their own dietary and health considerations and for their own faith considerations. And that for us is about the Jewish value of B'Tselem Elohim, about recognizing every single person as being made in the image of God and needing to retain all of the dignity that that divine spark has ignited in them. So I so appreciate that. And we see it as a way of like lessening the incredible burden that has been put on charities to go it alone. We used to have a very, very strong safety net in this country, and charity has had to fill in the gaps as the safety net has been rendered asunder, unfortunately, over the last several decades. Ashley, my question to you is, as this epidemic, unfortunately, pandemic escalates, are there resources that your volunteers can help seniors access beyond the charitable sector, like CalFresh? Is there a way for your volunteers or your organization to connect seniors with all of those other resources? I know you mentioned a hotline, and is there are there other referral services that you can provide and that everyone can have access to lessen the burden on your organization and your incredible frontline volunteers, and also just get more assistance to people at a time when they only need more and more every day?
Thank you for that question, Nama, and also thank you for bringing up the expansion of CalFresh. Most people don't realize that those individuals in California who were on SSI could not access CalFresh until last year. And so now all of us in this safety net zone whose clients are predominantly SSI, now can sign up for CalFresh. And so we're all working to make sure that people know they can do that and to assist them to do that. And that really leads me to the answer to your question. Generally we would do that through the kind of the home assessment and the volunteer interaction with clients to kind of do outreach in the home. Most of our seniors are still not tech savvy. Even if they are, they don't have internet connection because they can't afford it. So a lot of what we're going to have to do is to figure out how are we going to do what we used to do in the home, probably for a very long time because of the risk to the seniors. We're more of a risk to them than they are to us. And so we're going to have to figure out how to kind of call upon the volunteer forces to say, hey, we can do this by phone. We can help you by phone. We can kind of shift the outreach to doing that. So I think that's where we need to kind of pivot now that we're past knowing how to manage the basics. Now, how do we get back to reducing isolation, signing up people for services, having friendly visits by phone, maybe expanding the number of people that are doing safe shopping for our seniors. And so I think all of those things are back on the table. And honestly, it's just been in the last couple of weeks where we've had the bandwidth to kind of start having those conversations in a serious form.
Thank you, Ashley. And thank you, Kaushik and Captain Madsen, Ashley, Maggie, Hala, and Nama for your generosity of time, but also more importantly, for this rich exchange. I have to tell you on a very personal note, this pandemic has kind of accentuated the spiritual practice of cooking for me. And for so many other people, and even going to the grocery store has been a different experience. And I think none of us are taking for granted food in general, but I think today's conversation, if anything, has sensitized us to those who don't have the access to food. And I'm gonna ask each of our presenters today if they will forward all of the important links to which they referred, because we are going to be sending out the recording of this link to our 5,000 e-subscribers by day's end. And I think that there are some important resources that you mentioned that we would like to share. I also want to say just a few thank yous. One to Cynthia Zambucas, who is the Administrative Program Associate, without whom this and so many other programs of the Interfaith Council would not be possible. And I want to say also a very special thank you to the community branch of the San Francisco Department of Emergency Management. Hala mentioned over and over John McKnight, who is the treasurer of our council, but he is also the coordinator for the community branch, and his team, in this case, Kristen Lane, who has been our lead production staff on tech, as well as Kelly Garrity, Karen Nemsek, Trey Russell Allen, Maggie Smith, and Maria Davala, who were very instrumental in providing the technology for us to be able to convey this today. Next Thursday, we are going to be taking on a very interesting topic, and that is going to be COVID-19 and hate speech targeting Asian people. We're going to be welcoming Cynthia Choi, who is the co-director of Chinese for Affirmative Action. So we hope that you all will be able to join us next week, same time and same day. At this point, I would like to invite John McKnight to offer a final word on testing in our city.
Thank you, Michael, and greetings to everyone on the call. I want to be very brief, but I've got a call of action for you. I want you to go get tested. Nama, down in LA, you are exempt from this call to action, but everybody else, I'm going to ask you to get tested. Every San Francisco resident or essential worker coming into the city can get tested. And I'm encouraging you to do this for a very simple reason. If you're healthy right now, it's easy. You can go through a process, and I can tell you right now, I went through the process myself. It took me about 2 minutes to register, and it took me under 2 minutes to go through the entire procedure down at an open facility at Pier 30. There are multiple testing sites, but I want you to go through it now while you're healthy, so when the day comes that you or somebody you know is scared, that you've already been through it, and you know how to do it. You know how to give advice to your community so that you can help them get the help they need from a place of experience and confidence. So I'm asking you all, go get tested, learn the process, be ready to talk to your congregations, your communities about this. The link is up on your screen. The link will be sent out in our messaging, but essentially if you look up sf.gov/get-tested, sf.gov/get-tested. It'll take you to the screen. I promise you it is easy, and it is a good community service to have. Thank you, Michael, for the time, and grateful for everyone to be on this today.
Gladly. Kristen, Commissioner Hijazi asked for a very brief moment. So
she is unmuted.
Okay.
I can't see you guys. Okay.
We're all here.
Okay. I would like to, whoever would like to join me in moving forward on the effort, both from the Interfaith Council as well as the Human Rights Commission, to lead an effort both on the local and statewide level to provide that type of dietary needs, the same way New York, please let me know. I'm happy to share that information with Michael. Please contact me directly. And also the other thing that I'm undertaking, because I realized how many senior citizens do not know about CalFresh, which is heartbreaking to me, I'm also going to be starting to do personal outreach to the different communities, starting with the Tenderloin area, using that through the Human Rights Commission and all of the Tenderloin, also with TNDC and all the stakeholders, to print it out in different languages, especially in Chinese and Arabic, because there's a huge population, and Filipino, Tagalog, so that they also know that they can go online, and then also find ways to make sure that if they don't have Wi-Fi or any kind of internet connection, that someone can do it for them. So anyone that's interested in helping me with either or both, please feel free to contact me directly. I would love and be honored for your assistance.
Thank you, Commissioner Hijazi. The last word. And we look forward to seeing everyone next week. This concludes our program for the day. God bless you. Stay safe and stay well.
Thank you.